Eleanor Roosevelt once said, "Nothing that we learn in this world is ever wasted." So in many respects, I consider this webinar to be a really important pivot point for our work together, to celebrate 6 years of productive and progressive work, and to accelerate what works across what is the largest county in the United States, to unveil the first of some new evidence-based toolkits designed to support providers in establishing and improving developmental and behavioral screenings in their centers and in their clinics, and to expand developmental screenings and our EII strategies through Help Me Grow LA.
These are the objectives that were laid out in the original call for proposals that First 5 LA put out. And I think we've done a good job of meeting them. So our goal was to raise the competencies of community-based providers in this area, to improve young children and families' access to screening and early intervention, to increase parents' knowledge about healthy development as well as developmental delays, and to strengthen support for parents who have children with special needs.
The majority of parents who attended the focus groups reported that their knowledge of child development and parenting practices increased through their participation in the First Connections program. They learned about the importance of developmental screening services and related early intervention services. Some parents also reported being able to see how the screening services promoted improvements in their child's development and their ability to communicate with them. Also, through the First Connection program and the interaction of parents with grantees and different providers, several parents reported having a better understanding of the resources and availability of services, requirements, agencies, costs, or even changes in laws that affect their access to services. Some parents also reported an increase in peer support and that they were able to meet and learn from other parents with similar experiences about how to navigate the system and request additional services from different agencies.
So we came up with this idea of developing 3 toolkits, each one capturing the 3 different perspectives that we really got to know well through First Connections, and have them available to the public so that anyone could get them, and they would be very accessible and hopefully user-friendly. So the first one, which is called Early Screening, Better Outcomes, Developmental Screening and Referral Toolkit for Pediatric Medical Clinics, is out as of today, and we're going to show you a little peek of it. The second toolkit is going to be very similar but focused on family service agencies. And then third will be a toolkit geared to family resource centers. The purpose of these toolkits was to capture the lessons learned and really disseminate them broadly, to provide a tool for agencies that might want to do a developmental screening program of their own or enhance one that they already have. And then the goal of doing that would be that other communities that haven't yet been reached would have access to developmental screening, and also that it would support Help Me Grow efforts as far as building workforce capacity through disseminating and using these toolkits. The bulk of the toolkit has, it's a very sort of how-to, hands-on, what are the steps if you wanted to implement a developmental screening program. So kind of what, in the plan stage, what are things that you'd have to get in place before you start in terms of your team, your goals, your workflows, your timeline, and then to really think about how screening fits within the context of developmental conversations that hopefully staff are having with families already and will enhance the work that they're already doing. For the launch phase, there's a focus on how to train the staff at a clinic, and we actually provide a lot of training materials that we developed in partnership with the different sites. And then the third phase is to kind of evaluate, how's it going? Are we implementing as planned? And then how can we spread, if we have other clinic sites, how could we make sure that the program is implemented consistently across different sites.